depict two scenarios, two different. So after this total, we'll see what are the principles of giving feedback. What are certain basic principles to be followed? How should we give a feedback? It should be timely. In the sense, it should be immediately when we observe some specific performance, it should be timely. For example, in a class we see that if we are taking a theory class and we see some students doing some teaching things or something not to be done, we want to give a feedback. But immediately after a class, I am not free. I have some reporting work, I have to report this work, I have a meeting at this, or whatever, something. Then I tell you, come and meet me in the department. The student comes for 2 days and goes, I am not there. And third or fourth day he comes and we also would have forgotten for why I had called the student. And the students also, the effect goes off if we do that. Then even if you remember, that day in my class you were doing like this, the effect doesn't remain. So immediately it has to be given. Even during wards, rounds, whatever, it should be at least call them separately, spare some 5, it doesn't take much time. Spare some 5 minutes and give a feedback. It has to be immediately. That is, timely is very important. Then it has to be done in an appropriate setting. Like you saw in the first scenario, he called there only, the ward itself, and he fired at the student. In front of the patients, in front of other students, if we shout or if we tell, they may not, students will not be receptive. Because their mind is all the time manipulated and insulting others are saying. They are not looking into what the message is to be conveyed. They are all the time and they are looking what the patient will think, what the attendants will think, what my colleagues will think. You know, in that. So call them separately in an appropriate setting. It should be in a very conducive environment where they will be very receptive. Like you saw in the second scenario, we made a comfortable sit. Probably we may not do that. Sitting and all, it's okay, fine. At least we should be in a position where, you know, they will come out with that. Be assured that we are with you, I am with you, I understand your problem. Just show that the students will come out with a problem or they will be receptive to what we say. Then focus on the positive. First, whenever we call, whenever we start giving a feedback, focus on positive first. Remember that each student, each one of us have some positive point, even including our student. There will be definitely some, if you have observed, there will be something positive. Even in the first scenario, though she was not maintaining the privacy of the patient and all, she was doing it correctly. But only thing is, certain professionalism was not maintained. So focus on that positive. Observe that, oh, you are doing so well. In the second scenario, you saw that you are doing so well in your theory. You are doing excellent. Very good student. So encourage them. If you start with a positive note, students' minds open up and they will be receptive. Or else they close off their mind and whatever we say after that will be of no use. It's a waste of time for us, waste of time for them. So focus on the positive first and be specific and goal oriented. What is this? Is this the behavior you are going to do? What behavior is this? Which behavior they are doing? You have to be specific. What was the behavior? Because students may not realize their own mistakes. Many times we also have got scoldings. We didn't do it intentionally. Students don't do it intentionally. They may not realize the importance of that. Then if they shout, why did he shout? He shouted as we went. Many times has it not happened? So we should be specific on what performance. See, you were doing examination. That was right, but you could have maintained the privacy, which was wrong. So you be very specific, so that goal oriented, so that is intended for the future improvement. So that for that particular point, the student will improve next. Be descriptive, non-judgmental. What do we mean by this? Being non-judgmental. Be descriptive, non-judgmental means what? Unbiased, prefixed ideas, prejudiced,
and there is a that situation don't
assess. Don't come to the judgmental suddenly that you are so rude to the patient, so horrible. You are so harsh to the patient. So those terms, you are so useless. Useless fellow, get out of the ward. I'll send you out of the ward. Don't we do that? Many times we have faced it somewhere at least. So that useless fellow, it's like it's something judgmental. I'm totally useless for that. It's not, it's only for that particular. So don't use the terms, don't be judgmental about the personality. See, when we say something about judgmental, some terms like this, it applies to the whole personality. Let us not attack their personality. It's only that particular action. Because the student is good in other things, only that particular action. And every student, let us remember that they are not totally, they have something positive. They are doing good in something. Definitely that is there. Let us focus on that and encourage, let us encourage them. Then be constructive. What do you mean by this constructive? Positive, encouragement, assurance, make them improve. It should have something to make them improve. Like sir said, it should have a constructive criticism and plan of action. Suppose you tell me after the end of the session, madam, your session was very good. Suppose, no imagination. Suppose you tell me, and I don't know what was good. Good means what? Suppose they tell me, ma'am, it was okay, but okay. Think there was something. Like, what was not good? You are giving me a feedback that it wasn't that good. But what was not good, I don't know. So it doesn't help me in my further improvement. So if you tell me, suppose, ma'am, your slides were, suppose, they are good, okay. Suppose the slides were not good. In the sense you could have improved, you could have changed the contrast, or you could have increased the font. That could have increased the visibility. Whatever, you specific you tell them. Everything was okay, maybe your slides could have been improved. That was that. Then that gives a constructive criticism, or you give me a constructive feedback. There should also be a plan of action. Suggest some plan of action. You could have done this better. And many a times, yesterday we saw that you can include the participants for the pro play, and that's what we did today. So that is, that is intended for our. So suggest a plan of action. Constructive is that. They allow learners. Many a times we do that, we call them, we fire or we tell them. We don't ask them what it is, what they feel, what were their problems. Why did they do it? We never. Why should we do it? Why allow the learners input is, they feel that when you listen to them, they feel that, oh, when sir is with me, madam is with me, they are at least ready to listen me, I can open up, I can help what the problem is. Allow them. And attentive listening is important. Even when we allow them, sometimes the students, they don't come up to the point. You have to beat around the bush, they will not tell, and then they go around telling some story, otherwise they start. If you ask them some problem, they will be waiting for someone to ask the problem. No matter if asking my problem, let me tell, and they will not tell the story. And we then, okay, you tell me, you leave about that, you tell me now this one. I am not talking about that. Let us have some patience. Because once we listen to them attentively, they feel that, okay, I can open up to this person can help me. To get that confidence in a teacher. So these are the principles of giving effective feedback. Now, having a good body language does matter. Definitely we all agree when we speak, it does matter to us. The two extremes should be avoided when we give a feedback. This is a damaging feedback. There is something called a damaging feedback, that is feedback that is highly judgmental, negative, malicious and harmful. Ill-considered can be damaging to the recipient with no advantage gained, as nothing is there. Exactly what we saw in the first scenario, it was damaging. Sir intended to give, the teacher intended to give something, but it was not carried back to the student. So it was very much judgmental. You are so harsh. Don't you know this? How are you doing this? So the student was not receptive. Though the feedback was given, it was not useful, not effective. Nothing was done. That is damaging. Then there is something called as vanishing feedback. This is when the tough or difficult feedback is avoided. Rather than confronting the issues, the clinical teacher skirts around the edges and fails to deliver the message that needs to be heard. This is the problem with a teacher, that many a times PGs, maybe because we don't scold PGs as much as we scold UGs, undergraduates. Because we think that sometimes they come in service, this and how to tell them. We have sometimes female PGs or ladies, whoever, you feel uncomfortable how to tell them. They may feel bad. And maybe we don't tell directly, beating around the bush and all that. The message is again not forwarded or sent. So the message is lost. That is a hesitation. Because we don't follow the principles of feedback, maybe we hesitate, and that is vanishing feedback. Now, let us reflect on our experience of receiving or giving feedback. Definitely, somewhere in our personal life, in a professional life, as a student, somewhere we have received the feedback, or we have given the feedback. Can we share our experience? Any of us? You would have given, you would have received. Definitely, we haven't grown up without receiving any feedback. Somewhere we would have received. Sir, wants to say something.
So I started teaching during my post-graduation itself as I reported as a PhD in Bellary Medical College. I was the only person, there was no professor, no assistant, nothing. So I was initially very enthusiastic to be that in a government college to be. So when I took some feedback, because I was also a student, I want to learn my deficiencies. So some people expressed their views. One among them, which really I remember till now, that he told, sir, when you begin a sentence, you will be very forceful. You will be very, with lot of confidence you start, but ending note is not proper. I mean, say for example, penicillins act by inhibition of cell wall synthesis. So when we start with the penicillin, you will be very confident, but when we go to the ending note, you will be totally swallowing half of the last word. So that sentence communication will not be there, the continuity will not be there. That I remember even till now.
So, improved.
Yeah, definitely, I could.
We can say that it is improved. Sir is completely. That's very good.
When I was a lecturer in JNMC Medical College, initially we were not given theory classes. We were given only theoretical teaching. So we used to teach clinicals. Then later on, after about 1 year, we were given theory classes. So when I took my theory class, first class, I was very scared by the students, and we were expecting all galata and throwing all that. Then I had prepared my notes and gone, and I had slips, completely slips. I just seeing the slips and I was teaching them. Then finally, about 5-6 students after the class got over, they came and told me, madam, your clinical teaching is very good, where you don't use any papers and we'll be just discussing about the patient. We want you to do that. We don't want you to see the papers and show you are teaching clinically, then that only we want you to do. So that is still remember, and after that,
that is very good. I appreciate their open-mindedness, even from receiving from the students. They have improved on it. Except that many times as a teacher we have a little ego. Where should I express and I am perfect? And yes. Sir wants to say something.
As a student, we used to give feedback when we were students. Many of our teachers used to abuse like anything in Kannada in front of patients, so that you should never go to that ward only next time. Till the patients are discharged, all of them who were present on that day. So we used to give a feedback sheet. We used to write and put it in the chamber before the department opens without any names that we had to do. And whenever they used to come to our hostel, we used to switch off the light and then we used to tell whatever we want to tell. So all such feedbacks we used to give. So I made it a point that I receive feedback rather than after becoming a teacher. Even till today, wherever I have worked, I select few students, very good, mediocre, and I ask for a feedback, telling that it will not be affect anyway for my improvement. I always keep on collecting any new method I apply. I would like to collect the feedback. Not in a formally like this in a paper. I would like to ask whether it is good, bad, but all different types of students I would like to ask. That I have been doing. I will continue to do it, but not like this in a formal paper.
That's what it means. Though we say it is all these principles should be followed, it is very difficult to follow. At that time, it will take time. Who has patience? Who has time that much? But at least in that, somewhere we take out the time. Because as a teacher, our role is mentorship. All yesterday we discussed so many. Our role is as a facilitator. All that, at least some extent, if not every student, whenever we observe something, do a little bit of every day, little time for them. I think we can do justice to our job. Anybody would like to share anything? Okay. Now, why is feedback important? It facilitates change, definitely, when we are receiving. It improves the performance, reinforces the positive behaviors, and corrects the undesirable behaviors. Definitely, it will definitely help if it is given in a correct way. It will help in all this. It is very much valued by the students. We must realize here that students will be waiting for one word of encouragement from us. If you have observed in a class, suppose whoever answers, they say very good, or you take their name as she said or he said, next time they will be waiting to answer. If you have observed, they will be waiting to answer. Sir will ask her, madam will remember my name, and they will ask me. So that encouragement is always there, and that makes them feel it is very much valued. Oh, sir is concerned about me, then I should improve. That means they have an expectation in me. They are observing me. I should improve. That will be there from the students. It's very much valued by the students. And it decreases the learner anxiety. When we give them in a proper way, decreases the anxiety, definitely. Improves self-assessment for students. Okay. Now coming to feedback versus evaluation. Is the feedback same as evaluation? I have already put versus over there. It can't be same. So if they are different, in what way they are? Yes, ma'am. Yes, ma'am. Rightly, as madam says rightly, it is feedback is one thing immediately we are giving, and it is very specific. Whereas evaluation, you are giving global performance. You are giving your opinion about the global performance, but that also intended along with the improvement of the performance. That is for the global rating. For feedback, you are not rating me. Suppose if you give me immediately after my session, if you tell, you are just helping me for improvement of my own presentation, but you are not giving me some rating that you stand 5 or 10, 4 or whatever. Don't. But for the evaluation at the end of 3 days, which you will be filling up all this, the 3 days, that is an evaluation. Formative, we have a scope for feedback, exact, something like that, something. Exactly, but assessment is again different from evaluation. Let us not confuse again. Suppose if you say people met confused, something like that. So feedback is definitely not evaluation. Then what are the difference? Feedback is given timely, and it is in an informal setting. In the informal way, maybe we call that formal, but it is given orally. You can call separately and given. It is in the informal setting, and it is based on the observation. Content is very objective, and specific scope is it is intended for the specific action and for the improvement. Whereas evaluation is scheduled. We have at the end of 3 days, we give you evaluation. Today we give you, that is scheduled for 3 days performance. That is for the overall for the workshop. Then it is very formal. In the sense, we give it in a written format, something formal. There's a formal, filling up and all that. It's very formal. That is also based on objective, observation and objective. This is intended for the global performance along with grading and improvement. It's also for the grading and improvement. There is a slight difference. Now, since first day when we are seeing, we set the objectives, then we plan the teaching learning activities, and we plan for the summative assessment. So the student comes to us, we have all these activities. Where is the scope of feedback then of all this? Is it here? Is it here? Is it here? Day-to-day learning activities. The scope of feedback is in the day-to-day learning activities. That is formative. As morning sir was saying that after every session you can give, or after formative assessment you can give feedback. So you observe it and you can give a feedback. The barriers to give good feedback. What are the barriers? We all know now that we give, but still we may not be able to give all. We have not been able to give so far. What are the barriers? One is, why state the obvious? Many a times we think that as if it is not told to them, they have been taught in an orientation program. In my first class itself, I told them how to behave with a teacher, student, presentations. I told everything as if they don't know. Why should I tell them? Let them learn. That is also there. Sometimes some of the teachers have this attitude. Why should I say it? As if they don't know. We don't give. We avoid. Then this is awkward. How to tell this? As I said, one of the situation, female students, female PGs, or they're in service, how to tell them as if it's quite awkward. Forget about it, we'll not give. We avoid the situation. So we avoid that. then what's the use? Don't we say that? Yes, whatever you say, they are like that. We have, most of the time we have this attitude. Sir? And the students, we have the students, no? Yes, they will not improve. We have that most of them, when we discuss in the department, I come up with this point. This is what I have added actually from the, apart from the literature. When we just discuss in the department, whatever it is, how much to tell them? Yeah, over there like that only, don't tell, finish half an hour, finish the class in half an hour. They'll be talking, and how much is all batch, no? Take 20 minutes to get finished. Yeah, what is that? Just go tell orally why you want 1 point for them. You know, you have that this thing, but we don't realize how important it is for them. For us, there are 100 students. But that one student, it is 100% of that one student. We don't realize that. Then the next, I think, most important, again, the most common, most important is who has time. We have been into so many activities. I am into this committee, I am into that committee, and now we been into university. Here this, I am into university, that committee, NAT committee, UGC, this inspection, and we have 15 courses apart from MBBS. Let me tell you, I mean this is apart from the topic I'm saying, 15 courses. Each one of us is in charge of that batch. BSc nursing, BSc, physiotherapy, dental, nursing, all the other BSc, MLTC, BSc allied courses, where the basic sciences are must for them, and where all the basic science departments are involved. Their evaluation. Who has time for all this? Who has time? I don't have time. But we have to remember that somewhere we are, as a role of a teacher is to facilitate. So we have to remember, as one of the roles of the teacher, we are teachers by choice, by chance. We have to do a bit, our bit for it. Then it will be possible. What is this? Still not hungry, no? Still time is there, it's a Charlie. Not hungry, no? I think I have this sandwich, no? Not a time for breakfast, at least breakfast everybody has that. Not for break, not for lunch, sir. Lunch we'll have. Okay. That's it. No one, all this says, no one gave me this response, so I never realized. Student is in between, sandwich between True, sir. True. Student is sandwich. So we don't want the student to be sandwich. So we'll adopt the sandwich technique to give feedback to the students. It's the name of the technique that we use. There are different techniques, but the most adopted and most, which has been very effective worldwide, is sandwich, feedback sandwich technique. Why do they use this feedback sandwich? Why sandwich only? Why sandwich technique? What do we mean by it? Okay, what do we mean by sandwich technique? Mixture could have been, I think, panties or what do you say? Exactly, so what are those two similar things? Exactly, so we'll just go through that. Two positive, like our constructive criticism is given in between the two positive notes. So that is called as a feedback. So start with what did you do well. There is a positive feedback. That is one layer. Always. Then what could you have done better? Is constructive criticism here, positive criticism. Then how could you have done it better? What needs to be changed? Like I said, example, your slides needs to be changed, ma'am. Your slides can be improved. But how can it be improved? Slides need to be changed means what should I change? Is it background, the color, the design, the core, linings? What do I need to change? So if you tell me, ma'am, there were too overcrowded, you could have reduced the size or number, you could have reduced, increased the font, you could have used this font particularly, you could use this color background, then that is a, how could you have, that is a constructive advice. That means here there is a plan of action, there is a suggestion for a plan of action, what can I do to do myself better, to improve myself. And end with a positive note. Make sure that you are made clear and check the understanding, and end with a note of positive or encouragement. I'm sure you will do well. Like in this second scenario you said, there's nothing big deal, you have been doing so well, that's not a problem at all, you will definitely do well, I'm sure you will do well. That gives a, again, positive note. So, give a constructive criticism between the two positive notes. Start with a positive note, give a constructive feedback, and then end with a positive. That is feedback sandwich. So take home message is, feedback can have a very powerful effect on learning. For feedback to occur in the setting of medical education, performance must be observed. The focus of feedback influences its effectiveness. Definitely, if you are focused, it will be more effective. Feedback is not evaluation. Let us remember this, and thank you.